Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know very well that I am MD, Doctor of Medicine in Ayurvedic medicine, that is Kaya Chikitsa subject, and also MD in Ayurvedic physiology. So naturally, double post graduation. I have the expert team of doctors to treat your problems. So for paid online consultation, you can always welcome and do WhatsApp on 9226810630. Don't worry, the number is given in the description. Please check it. Okay. My dear friends, we are making the series Ayurveda in GP, that is Ayurveda in general medical practice. Today's topic is pruritus. Pruritus is also called as itching. Itching. Can you see? Itching. This is itching. Oh my God, I am getting itching. Itching. Itching is a pruritus. This is basically origin is in the fungal infection or allergy according to the modern side. Now, what is about the Ayurveda? Ayurveda is saying that Kandu, this particular symptom can arise because of the different things, like for example, maybe because of the tvaka dushti, tvaka vikar, or the skin diseases, dermatological problems, or it may be some metabolic disturbances. Even in the cases of jaundice, if there is a severe unbearable itching and bilirubin level is very, very high, this is not the good sign, my dear friends. This can indicate the obstructive jaundice. So there are so many things. Simple eczema can create the pruritus, some worm infestation. We are seeing all these causes. But let me tell you something about Ayurveda more, because whenever there is itching, Ayurveda says there is a problem of kleda. Oh my God, sir, what is this kleda? Kleda is unwanted waste products developed during the tissue metabolism. Of course, there are a lot of different meanings of kleda in Ayurveda, but this about the pruritus, this is I am telling you the pathological aspect of kleda. If it is a too much waste is arm is created, then that particular pruritus or itching, this particular symptom can start. So, to control this pruritus, you have to avoid two things: Vata Prakop Ahar Vihar and also Kapha Prakopak Ahar Vihar. Why, sir, Vata? Just now you have told the Kapha. Because Vata having the properties Tatra Ruksho Laghu Shitaha Kharasukshmaschalo Nilaha. So, Ruksha dryness is always associated with itching. That's why I am telling that too much Vata Prakop can also give you the problem of itching. And that's why, you know, when you talk about the age variation, in the childhood, Kapha dominance is there. In middle age, youth, there is a Pitta dominance. Dominance, I am saying, that means comparatively dominance. I mean, from birth to death, everybody has a Vata, Pitta, Kapha. But in the children, with compared to Vata, Pitta, Kapha is more. In the youth, young age, with compared to Vata, Kapha, Pitta is more. And in the old age, with compared to the Pitta and Kapha, Vata dominance is always there in the old age. And because of the Vata dominance, all the old people, they suffer from itching. And simple thing to prevent that itching pruritus problem in the old age, you can apply simple oil massage. Tilataila oil or the coconut oil is the best to control the dryness. And when dryness will control, automatically pruritus will go. But when there is a kapha dominance, then you should avoid the fatty foods, number one. And second, most dangerous thing for the pruritus, it will not stop if you are going continue eating the fermented products. What is the fermented? In Ayurveda, the word is abhishandi. That means, for example, let me tell you, curd. This is called as a fermenting product. So when we eat the curd or curd-like substances, like example, dhokla, uttappa, all these fermented products, then lot of secretions are developed, and they are maybe unwanted, pathological, can be compared with the kleda, and that gives you the problem like itching or the pruritus. So let us start to discuss what are the causes and how we can treat this symptom with Ayurveda. So first is etiology, that is naturally the causes. First is a simple allergic manifestation. Skin diseases like scabies, pediculosis, urticaria, lichen planus, dermatitis, herpetiformis, lichen simplex, chronicus. In all these diseases, skin diseases, itching will be there. Systemic diseases like diabetes mellitus, liver diseases, uremia, Hodgkin disease, leukemia, polycythemia, certain types of anemias, some malignant tumors, and carcinoid syndrome, all these can cause the itching of your body. Some medicines or some drugs like morphine, chloroquine, cocaine can cause as a complication or side effect the itching. Psychogenic is also one of the cause. Some mental stress is there. No systemic, no local causes. Pregnancy, yes, during the pregnancy also the abdominal skin is stretched, and because of that stretching of the skin of the abdomen, little itching will be there. Senile pruritus, just now I have discussed senile means after 50, after 60, 60 plus, 70 plus, vata dominus, pruritus will be there. Now, what to do regarding the another cause causing set, that is called as a localized pruritus. So what can be the causes? Pruritus ani, anorectal region, Budadwar. So there is always possibility of threadworms, proctitis, hemorrhoids, anal fissure, pericardica. Broad use of internally broad spectrum antibiotics can give the localized itching. Then neurodermatitis, then pruritus vulvi in the females, functional associated with nervous tensions, trichomonal vaginitis, vaginal discharge, for example, gonorrhea, that is a sexually transmitted disease. Then it is coming from the male partner, chronic cervicitis, diabetes, local use of chemicals, menopause, then Crauris vulvi, senile vaginitis, lichen sclerosus, atropicus, and threadworms. My dear friends, here I would like to make concentration on the diabetes. Please remember, in male or female, if you find that his itching problem is not resolving, his skin problem is not resolving, is not getting cured. So immediately, either male or female, you please do the fasting and post glucose blood sugar, not PP, not random fasting and post glucose, or also you can do glycosylated hemoglobin. The 3-month average sugar will be noted, and then accordingly you can if it is a diabetes must be controlled to treat the pruritus. Now, pruritus of the male genitalia in the males, scabies, then tinea cruris, tinea corporis. Tinea is a fungal infection, diabetes, and also psychogenic. Other sites, for example, ear. If I get the itching, then it may be suggesting fungal infection or chronic otitis media. For eyelids, if I get itching over here, that can be because of the neurodermatitis or blepharitis. If I get the itching in the nostril, internal parasites, or sometimes, very rarely, but it can indicate brain tumor, OMG. Oh my God, yes. Now we will talk about the investigations. Which investigations can you do to get the conclusion for this pruritus diagnosis? Hemogram. It will rule out the anemic condition, normal hemoglobin 12 to 14 gram%, leukemia by premature cells in the peripheral blood smear. For evidence, even you can check for eosinophilia, typically indicating allergic conditions, urine for pregnancy test, stool examination for parasitic infections like threadworm, blood urea to rule out the uremia, kidney problems, blood sugar fasting and post glucose, not PP. If it is a known case of diabetes mellitus, PP is okay, but not known diabetes, then basic fasting and post glucose, or there may be modified GTT or complete GTT, glucose tolerance test, LFT, liver function test, to rule out any liver pathology. Now, what is the treatment? According to the cause, you have to take the care of causes. Now, symptomatically, what advice you can give? The best medicine is Kledanashak, and liver metabolic stimulator is Arogyavardhini, 2 tablets 3 times in a day. Then Laghu Malini Vasant, Kal Khapri and Marich, which is a content, 2 tablets 3 times in a day. Then Krumi Kuthar Ras to take care of worms, 2 tablets 3 times in a day. Triphala Churna, as it is a problem of impurity, laxative. Then also the Panchakarma is very much beneficial for pruritus complaint. Triphala Churna 1 teaspoon with warm water at night, local application, talcum powder, senile pruritus, regular massage by Narayan oil or coconut oil. So my dear friends, we have discussed a looking to be very minor but very troublesome problem for the patient. So diagnose properly and treat properly. Thank you very much. Don't forget to subscribe my YouTube channel. See you in the next video. Till then, best of luck and take care. And I wish you all the best. We will see you in the next video. Thank you very much.